Global Health Series number 59. I'm Professor Silvanus Okeke. I had discussed within the week that we were shifting from life expectancy into public health diseases. There are things that make people to live shorter lives, and the idea here is for us to bring in a kind of health prevention ideas where people live and live better lives. The public need to be aware of these diseases. Yesterday we talked of bacterial infection. Now we want to talk about diphtheria. Diphtheria is a serious bacterial infection that affects the mucous membrane of the throat and the nose. It affects the throat and it affects the nose. And being a kind of bacteria, it is a very serious kind of disease that it brings about because it is passed from person to person. It is a foodborne disease, which means the kind of food you eat determines whether you have diphtheria or not. So I will let people know that this question of dipping hand in one plate so many people is very dangerous, because if that kind of bacteria is there, it will just be passed on from one person to the other. And hygiene is very necessary in order to avoid this kind of bacteria. When left untreated, it causes a kind of severe damage to the kidney. Some of the people that have kidney failure or kidney diseases could have been just a bacteria that started somewhere, which is the diphtheria. Or sometimes again, a kind of nervous breakdown. Somebody will be complaining, I'm weak, I can't do anything. Or maybe they take the person to a clinic for treatment and you discover them saying they don't know what's wrong with the person. When there is a kind of nervous breakdown, it could be diphtheria that is the cause, this kind of very dangerous bacteria. So we need to be aware of it. Also, heart attack and heart failure could be a result of it. If the bacteria enters somebody's body, it could cause a heart failure. And then we say over there that maybe somebody would have killed the person. That is not the issue. The environment which you live should determine the kind of things you do, the kind of food you eat, how hygienic is the place in order to avoid diseases like diphtheria, so that people won't be having nervous breakdown, people won't be having kidney diseases and also heart failure from time to time. So we have to be aware of this kind of thing so that we know the kind of food we eat and the kind of water we drink. Of course, sometimes the dangerous environment makes it impossible because of even some of them that are airborne. So it's necessary we be in a position to regulate the kind of food we eat. So I'm bringing into your knowledge diphtheria, which is a kind of bacteria which comes with food. We have to be careful with that kind of food, not when the food is already sour, you say you take it, doesn't do anything, and in the process the person gets sick, or the person has a nervous breakdown, or even heart failure that could cause death. So those are things we could just prevent by the way we do things, by how clean the environment is, the kind of food we eat, how we take care of our food in order not to develop some of these bacteria and some of these diseases. So I'll be giving you this little by little. You need to take note of them. You need to have your own notes, trying to put them down. So at the end of the day, you know that there are things like bacterial infection, there's a disease like diphtheria, which is foodborne, and so on and so forth. By the time you have accumulated knowledge of all these things, you'll be careful the way you take care of your environment, where you live, what you eat, in order to have an elongated life, not just dying anyhow. Thank you. We will continue from there when we meet again.